Did you know that just one unspayed female cat and her offspring can theoretically produce over 400,000 cats in 7 years under ideal breeding conditions? That number comes from mathematical population models used in overpopulation awareness campaigns. While real-world survival rates vary, the reproductive potential is absolutely staggering. And yet, millions of healthy, highly adoptable cats enter crowded shelters every single year. Welcome back to Cat Care Academy. I am genuinely glad you are here. If you noticed a spike in online searches around February 24th, you are not imagining it. World Spay Day sparked serious conversations among pet parents everywhere. Questions like, when is the safest and most appropriate age? Will my cat's personality change? What does recovery really look like behind closed doors? Today, we are answering all of that using evidence-based veterinary medicine and guidelines supported by leading organizations, including the American Veterinary Medical Association and the American Association of Feline Practitioners. Before you schedule that appointment, there is a persistent myth about the right age that can unintentionally increase long-term health and behavioral risks. We are clearing that up right now. Let us begin with the science. Spaying and neutering is not only about preventing unwanted litters, it is strongly associated with measurable improvements in feline health outcomes and lifespan statistics. Large-scale veterinary data reviewed by the American Veterinary Medical Association shows that spayed females on average live longer than intact females. Neutered males also demonstrate increased average lifespan compared to intact males. This is not magic, it is biology. Spaying eliminates the risk of Pyometra, a severe, potentially fatal uterine infection that requires emergency surgery if untreated. It also removes the possibility of ovarian and uterine cancers. Neutering eliminates the risk of testicular cancer and significantly reduces behaviors that expose males to trauma and infectious disease. Perhaps most importantly, spaying a female cat before her first heat cycle dramatically lowers the lifetime risk of mammary tumors, which are malignant in approximately 85 to 90% of feline cases. That statistic alone is one of the strongest medical arguments in favor of early sterilization. This single preventive decision does not guarantee a specific lifespan, but it substantially reduces several major risk categories that shorten feline lives. Now let us shift from theory to reality. What actually happens when you bring your cat home? Immediately after surgery, your cat may appear groggy, slightly uncoordinated, or more vocal than usual. This is a normal anesthetic recovery response. Their body is metabolizing the medication, and full alertness usually returns within 12 to 24 hours. Here are the 4 most searched concerns, clarified clearly and accurately. First, the right age. For decades, 6 months was the commonly recommended timeline. However, both the American Association of Feline Practitioners and the Association of Shelter Veterinarians now endorse the Fix by 5 initiative, meaning sterilization by 5 months of age. Why? Because most cats reach sexual maturity between 5 and 6 months. Performing the procedure before full reproductive maturity prevents accidental litters and reduces the development of hormone-driven behaviors like spraying and roaming. Second, personality changes. This is one of the biggest myths in the cat community. Spaying and neutering do not erase your cat's personality. They do not remove playfulness, affection, intelligence, or curiosity. What typically decreases are hormone-driven stress behaviors, territorial marking, escape attempts, aggressive competition, and heat-related vocalization. In many cases, owners report their cats becoming more relaxed and focused on home-based interaction rather than reproductive instinct. Third, spraying. Urine marking in intact males is largely testosterone-driven. If neutering occurs before the behavior becomes habitual, the likelihood of long-term spraying drops dramatically. Waiting too long can allow it to transition from hormonal reflex to learned behavior, which is harder to modify. Fourth, metabolism and weight. It is true that metabolic rate may decrease slightly after sterilization due to hormonal shifts. However, weight gain is not an automatic outcome of surgery. It occurs when calorie intake remains at kitten-level energy requirements despite reduced hormonal demand. This is a management issue, not a personality flaw. Now let us talk about recovery, because this is where even responsible owners can accidentally create complications. When you bring your cat home, create a controlled recovery zone. A small, quiet room, such as a spare bathroom, works perfectly. Alternatively, a large crate with soft bedding is ideal. Limit jumping and climbing for 10 to 14 days. Internal sutures need time to stabilize tissue healing. A single high jump can strain the incision. Place food, water, and a low-sided litter box within easy reach. Reduced stretching equals reduced tension on abdominal muscles. Now let us address incision protection. Traditional hard plastic cones are effective but often stressful. Modern alternatives include soft recovery collars and feline surgical recovery suits, which provide incision coverage while allowing comfortable mobility. Pain management must strictly follow veterinary instructions. Never administer human medications such as acetaminophen or ibuprofen. These drugs are toxic to cats and can cause fatal organ failure. Always use only the medication prescribed by your veterinarian. If your cat resists pills, ask about compounded liquid formulations or flavored suspensions. Many clinics offer these options to reduce stress for both pet and owner. Now, here is the most important post-surgical monitoring guideline. Cats instinctively hide discomfort. Monitor appetite closely. Skipping one meal the first evening can be normal. Refusing food or water beyond 24 hours is not. Also monitor litter box behavior. Straining without producing urine or feces requires immediate veterinary attention. Do not wait. After the 2-week healing period, you transition into long-term management. Switch gradually to an appropriate adult maintenance diet formulated for sterilized cats. These diets are balanced to support lean muscle mass while preventing excess weight gain. Increase structured play. 2 15-minute interactive sessions per day using wand toys stimulates natural predatory behavior, maintains muscle tone, and supports mental health. The long-term takeaway, supported by leading feline medical authorities, is simple: consistency. Spaying and neutering is foundational preventive medicine. It reduces reproductive cancers, eliminates Pyometra risk, lowers trauma exposure, and supports population control. But optimal health still depends on nutrition, enrichment, and routine veterinary care. By choosing sterilization at the appropriate age, you are not only protecting your own cat's health, you are contributing to reducing the burden on shelters and preventing future suffering from preventable overpopulation. Let us recap clearly. Ideal timing: by 5 months of age. Proven health risk reduction: mammary tumors, pyometra, testicular cancer. Recovery requires confinement and incision protection. No human pain medications, ever. Adjust diet and increase structured play after healing. This is not fear-based messaging. It is preventive science. If you found this breakdown helpful and want more fully evidence-based feline care guidance, subscribe to Cat Care Academy. We publish research-informed videos designed to help you make confident medical decisions for your cat. Now, I would love to hear from you. If your cat has already been spayed or neutered, what surprised you most about their recovery? If you are preparing for surgery, what is your biggest concern? Drop your thoughts below. I read every comment. And as always, thank you for choosing to be an informed, responsible cat parent. I will see you and your feline companion in the next video.